So good evening, everyone. Thank you so much for joining in to our Prevention and Wellness series presented by the Cancer Survivors Park Alliance. My name is Mechelle Allen. I am a social worker by training, and I am also a proud board member of our Cancer Survivors Park Alliance. And as I mentioned, today's topic for our Cancer and Prevention and Wellness series is navigating cancer logistics. And so we have a lovely panel set up for you tonight. And before we get started on our panel discussion, I will have our panelists introduce themselves and then we will get into our topics. So starting with you.
Okay, my name is Kaylin Millay. I was diagnosed at 26 with Hodgkin's lymphoma, and I'm in remission now.
I'm Andrea Reeder, and I was diagnosed with breast cancer in 2019. I'm currently 39, and I have 3 sons.
And I'm Sarah Batson. I was diagnosed with breast cancer at age 47, and I was the breast navigator here at St. Francis, and still am the breast navigator, but had breast cancer and was treated here.
Thank you so much, ladies. And again, thank you all for joining us this evening. And before we get started, I hope that this topic not only reaches someone, but that you are informed as well as can relate to some of the information that will be shared tonight. So I am so excited to not only dive into your personal experiences as they relate to cancer, but what knowledge you can share with others and viewers tonight. Okay, so one of the first topics that we wanted to get into as far as finances, and I know, of course, the impact of cancer can come in various ways, but speaking specifically in reference to finances as well as insurance. So we'll start with you, Andrea. What questions or worries did you have about finances in the beginning of your journey with cancer and at the time that you were diagnosed?
Well, the first fear that I had is I feel like everybody talks about your one breast cancer or cancer diagnosis away from bankruptcy or losing your home or your car. So that is the first thing that I thought of. I was very scared, thought I was going to lose everything. I just went through a divorce 6 months prior. So I was very scared. Coming here to Bon Secours, they set me up with a financial counselor, as well as, I had insurance and things worked out just fine. And I did not have to worry about those things during the time I was sick.
And if you could further elaborate in reference to far as being a patient of Bon Secours, but not only getting connected to a financial navigator, how were they able to support you, or what things did you see come about throughout the experience?
So with the financial advisor, they kind of dig into like what your needs are, what your insurance will cover, what it will not cover, even things as far as like getting rides. I didn't have to take advantage of that at the time, but everything they dove into it, and they were able to help with like co-pays on, your chemo treatments. They were fantastic.
And of course, I know along just trying to process a cancer diagnosis and then being hit with, what will insurance pay? What things will I have to pay out of pocket? So it's good to know that you had that support available to you to help you navigate that experience. So Sarah, diving in a little more to your experience, what would you say far as with insurance or costs related to healthcare? How did that impact with prescriptions as well as anything else that you felt like you needed throughout your case?
So I think one thing that happens is when you need chemotherapy, you're all of a sudden looking at the cost, obviously, and similar experience, the financial counselors, when it came to, so I was an employee, of course, and had insurance, but even with your co-pays, sometimes that financially is not feasible to pay even your copay. So they are very knowledgeable and sought out resources to help supplement my insurance. whether that be from the drug company or however they do it. I'm glad they know how to do it. But, they would come to me and say, okay, we're gonna sign this and we're gonna get this and do this for you. And it was so helpful because, I know my husband said to me, we're just not gonna worry about that. We can't worry about that. We kind of have to put it on a shelf. And, we'll figure it out because we've got to do treatment. So, there is, that's always a concern, but there are resources and lots of resources that as even a patient, you're not going to know about. That's why I'm so thankful for a financial team.
Definitely. And Sarah, when you were connected to that financial navigator, did you feel like it gave you some relief to then solely focus on treatment as well as other things that you felt like were?
Yes, because you could truly, there's only so much bandwidth you have. And obviously, when you're going through treatment, you have less bandwidth. So you can kind of set that aside and somebody else is watching out and helping you to get the treatment you need.
It's so good and thankful to have financial advisors as well as navigators, because I know the insurance world can not only be hard to navigate, but of course, like I said, just having to first focus on processing a new diagnosis as well as what's ahead, and then to have, the financial debt, or as well as just, those financial insecurities just when.
Yes.
So I can totally understand that. So Caitlin, how was your job affected, or what was your workplace? Was it helpful, or did you feel like accommodations were made throughout your initial diagnosis as well as going through treatment?
Yeah, I was a teacher, or I still am a teacher. So I was in the middle of the school year when I was diagnosed. It was January, and we only have 180 days with our students. So my first panic was that I had to leave my class. And I remember, I think I told you, I was like, I'm not gonna be a teacher anymore. And that was my whole personality. So that affected me a lot, but my workplace was helpful because I was able to have a long-term sub. It was very easy, and I teach kindergarten, so I have an assistant. So it was very easy to hand part of that job over to someone else and let them do it. I stopped working for 8 weeks, and one of those weeks happened to be spring break. And I had banked up enough sick time with teaching to be able to leave for that amount of time. And then I went back at the very end of the school year just to say bye to those students. I was also I had been moved to a different school, so I also had to pack up my classroom and leave during this. So it was a lot of stuff going on at the same time, but it was nice because I filled out stuff for FMLA and they held my job for me. And I didn't have to have that much affected outward. Nice.
And I wanted to further explore, you said earlier on, it was questionable whether or not you were going to continue teaching. What sparked that change to feel that I will continue doing this, or I can get through this with the accommodations or the support of my coworkers? What made you say, I'll just continue rather just stop working altogether?
I think it was more so I felt I needed to be there for my students, just the type of students that I taught. I felt like I needed to be there for them because I was the person that I felt was their role model for their stability in their lives. So I felt like I needed to be there. That was the hard part of leaving, but it definitely was the people that I worked with, and my principal had been a cancer survivor, so she understood and was very accommodating. It didn't have. There's a lot of rules of teaching that you can only be gone for 10 days and you can only do this, or you have to have paperwork done. And she was very we got it for you, just go. So it was very helpful.
And did you feel like throughout that period, of course, I know finances can change versus working full time and then having an intermittent leave or completing FMLA, how are you financially supported with those changes coming about? Who did you feel like you could rely on?
Yeah, I did have to rely on my parents. So I had just moved a month or two before I was diagnosed into a more expensive living situation with my sister. And I had to I tried to call and say oh, I need to change. I need to cancel my lease. I need to move. I can't live here and do this. And because I didn't get paid my full amount that I was used to getting paid. And it's very stable job, but it's not, it's, it's teaching, so you don't get a big paycheck anyway. So I had to deal with all of that at the same time as well. And that was difficult because if you have, terminal illness, a lot of states have where you can break your lease, but I was not able to, so it was a more of a financial burden in that direction. With having to leave, but my parents were very supportive. Yeah, it was very worrisome because I thought that all the money I had saved in my 5 years of time of teaching, I thought I was like, oh, I'm just gonna get rid of that whole savings account just on this. And thankfully that didn't end up happening.
Good, good. And all of you touched on an important piece in reference to finances of just, again, how that impacted your household, whether it was, being a parent or whether it was you, of course, living independently and staying on your own. And I think it's extremely important, of course, when you are navigating through a diagnosis initially, as a social worker, relying on those resources. And of course, not only making your needs known, but of course, having social workers and financial navigators available to you to not only walk you through that process, but to make you aware of resources that you may not even heard of or knew about. So thank you all for sharing your, light on the important piece of having health insurance, but not only that, knowing who to go to whenever you have those issues or concerns. So transitioning into a new topic, we're going to talk about relationships, whether that be with your spouse, your immediate family, or even friends. And so, Andrea, this question is for you. It states, in what ways were your relationships with those around you affected by your diagnosis, affected by your actual treatment or side effects?
I think that it affected my kids mostly. When I was going through treatment, they were very scared. They were very, very scared. And also my parents and my sister, were very affected. And I'm very thankful that I had them to support me during the process, because when I had chemo and had treatments, there was a lot of things that I wasn't able to do, cook, pick up kids when I had surgeries and things like that. So I relied a lot on my parents and my sister to help me, but my kids did really great through the process, and I feel like it strengthened us as a family to go through it. But.
And when you said, because if you don't mind me asking, how old were your children at the time?
So I had a 5-year-old, I had an 8-year-old, and a 10-year-old.
Okay, and with their insight at that age, how did you break down or have them to understand what was currently going on with your health? Did you feel like did they have a clear understanding? And I know at their age, they probably didn't have a full understanding, but did they kind of comprehend the changes that were coming about, would you say?
I was very scared to tell them and how to tell them. But I feel like with different age groups, you have to kind of talk to them differently. My youngest obviously did not understand at all. He was very scared that I was going to lose my hair. That was his worry. Whereas, my oldest one was worried that, something was going to happen to me. So, but I think sitting down and being honest with them and talking to them as a family is what we did as well. And that was really helpful. And they did understand. And we also were able to give them some counseling too, so that they could, get out their emotions and their fears.
So you would say that open communication amongst your family was really helpful in this sense, as far as them knowing and being aware of what was going on?
Yes.
Sarah, this question is for you. It says, were there any concerns expressed from your spouse or family during your journey, or throughout the process?
So, I had just been married a year when I was diagnosed. So, it kind of rocked our world, of course. And had 3 kids, 9, 11, and 16. And so it led to some very honest and frank conversations with my husband. Because you have to think about, well, how am I going to change? Am I going to need mastectomy? Because in the beginning, you don't know any of that. And, you know, it leads to some very honest and kind of emotionally charged conversations, just being honest in ways you never thought you'd have to be with that person. But it was good and it strengthened us. And then as far as my family, I'm from a really big family. I'm the youngest of 7 kids, but they all live kind of scattered throughout the country. And I called my sister, who was the project manager of the family, and she's my best friend. And I said, I'm going to need you to arrange a conference call because I cannot repeat this 7 times and to mom. And so we just did it over a big phone call. And I tell people this all the time. Part of going through this is letting people help you, which is kind of most people have a hard time receiving. So like my family, since they were afar, they did things like they helped pay for somebody to come clean my house because they knew I wouldn't have a bandwidth. You know, so it affected relationships, but I think at the end of the day and after the diagnosis, I think I would say relationships are stronger because of cancer.
Would you say this experience was one of the most difficult challenges for you?
Oh, probably, but my husband is so strong. And, you know, I didn't doubt that we would come through this, and he was there for our kids and just, but it did, you know, made us much stronger.
You know, I'm glad you talked about as far as like interpersonal relationships, but also being newly married, because in a lot of cases you hear survivors talk about physical appearance, different changes that come about. And of course, as you can imagine, I know we're all human, and of course you may be used to a certain way of things going or styles and such, but as your body emotionally and physically going through those changes, you can imagine how good it probably feels to have someone who is there walking step by step, of course, so thank you for sharing that. And so, Kaylin, this question is for you. What part of your journey most affected your relationship with your family as well as friends?
Yeah, I think with my family, my mom came with me to every chemo, so I got that like solid 8 hours with her. And I live an hour from the cancer center, so it took a while at the time to get here. So I got the hour in the car and an hour on the way back, and on the way back I was just sleeping, but yeah, I got that solid 8 hours with her, so I feel like it really like strengthened our relationship. And she would bring food, which you don't think that you would want during chemo, but I ate it because she's Italian and I was not tonight. And drinks, and we would like sit, it was kind of like, I don't know, it brought like peace to me, so that was really helpful. And I always saw like in movies, there were, you know, a bunch of people sitting around, or it was so nice to be here because you had your own private room. And different people would come. Sometimes my dad would bring me more lunch, or my sister would come a couple times, or I know you would pop by, or different nurses, or the chaplain would pop by. And it was nice to see everybody, but really I think chemo was the most strengthening part of it, because I think it took the biggest toll on me physically and emotionally. And I think that's when they could step up and really show like that was where our strength could come from.
And when you were going through your treatment, as far as you stating having those long hours and going to chemotherapy, how did you see your mom respond to that? Was it a lot for her to see? Because are you the only child, or do you have siblings?
I have one sister.
Okay.
And my mom had been through cancer journeys with her parents, like my grandmother, and other people in her life. So I think it was definitely more traumatizing because I was her daughter. That was taxing on her. I think it took a lot out of her. But mainly it was like, you know, physically you look different when you go into chemo. I felt so great because it had been, you know, weeks in between, and then I would look terrible when we left. And I think that was really hard for her. And I would be like, oh, it's fine. But That was hard for everyone, but then you start feeling better and then, it's a cycle, but once you get done with it and you really are done, it definitely feels a lot better.
And I think a lot of you all touched on like the importance of just having support. It's hard for me to imagine, of course, with the work that I do in social work, you do see patients and survivors who may not have that support available to them. And that can be, of course, very brutal because you're used to, of course, maybe having someone to walk you through it or having someone that you can call and depend on. And so it's good to hear that through all of your experiences, you had someone not only that you could rely on, but depend on. And of course, as Sarah, you mentioned for us, that independency, I think we're go-getters sometimes and we're used to being self-sufficient and independent. And when you have to take a step back and let others help you, it can be a lot to take in. But I think it's important to utilize that support, to just have an emotionally stable mind to walk through, for sure.
And even in the when in the waiting area, when you're waiting to go into infusion, that was the most, I guess, communal conversations that I've had, and just seeing other people and people be like, oh, how old are you and why are you here and what's wrong with you? And it's funny because you all have cancer, but it's so different. Everybody's story is so different.
Yeah.
And it was nice to get to see other people. And some people chose to come by themselves because they liked that piece of that private room that was by themselves. They could look out the window or watch TV, and it was just their own little part of the piece, I guess, with it. Even I didn't have my friends, I didn't have anyone come to chemo. I didn't want them to come during that. And I think everyone's different, so there's different things that you can do. You don't have to have.
I would say.
Mm-hmm.
And I think also to just, of course, like you said, adjusting step by step, of course, because you don't know, of course, what's ahead or what to expect initially. But I think, just like you said, having someone with you or walking you through those things and then loving you unconditionally despite all of those changes coming about. So that just goes into the value of not only support, but for you ladies being here today and sharing your stories, because I do think not only, as you mentioned, everyone is different, but everyone copes differently. And what may work for one person may not work for the other. So I think it's good for you all to not only share, your experience and what things help you, but also that can be encouraging or uplifting to someone else. So moving on to our next topic, this is about managing day-to-day responsibilities. And so, Andrea, this question is for you. It states, how did you manage to juggle children, work, responsibilities? Of course, we know with cancer, life doesn't stop, as any hardship, but what things and how did you navigate all of those things with life still continuing to go and as well as still having to be your mother?
I think the big thing is, like Sarah touched on, I am not one to ask for help, and you have to accept help, and ask for it, accept it. And there were a lot of people that offered to help me. My church group gave me gift cards for restaurants, which was a complete blessing. Because there were days I didn't feel like cooking. I could grab food for the kids. There were friends and coworkers and family members who brought me food. My mom and my sister helped me out daily whenever I had chemo treatments and when I had surgeries, to cook, to transport my kids. I actually had the help of my ex-husband too. He worked a lot with me and helped me with the kids and transporting them to school and events and things like that too. And as far as going to work and appointments and things, thankfully I was able to drive. But my mom came to every single chemo treatment with me as well. She helped me co-cap.
Oh, wow.
So, she came to every appointment, and thankfully someone came with me to my doctor's appointments and stuff like that too. So I'm very fortunate, but I will say that there were many people like Sarah who were there for me too. So if there's people that don't have family and friends, people here are so wonderful and so helpful and supportive. So it was a very difficult process, but I made it through with the help of the community and a lot of people and friends.
It truly takes a village, just hearing you say that, as far as just having even a church community as well, like you said, as far as just not having the energy to cook. And then, of course, still, like you said, having children who may not have a full understanding of what's going on. So still trying to, of course, normalize things that are, occurring around you, but still, of course, taking care of you, essentially. So I'm glad that you were able to have that support. Sarah, this question is for you, and as a navigator as well as a survivor, what resources do you feel like were helpful to you? And then what resources as a breast navigator are you aware of that you feel like could help someone who doesn't have a lot of support or may have financial insecurities?
So as we're talking, it makes me think about, like I have a big family, but they aren't here. And there's other people that have that situation. So, neighbors stepped up, and it kind of strengthened those relationships, and you have to rely on those people as well as your church family, or everybody's support system looks different. But I think locally we have some very good resources. I make sure the patients know about the cancer survivor card. They get their calendar and they can look and see if there's something either virtually or in person that they can attend. The Neighborhood Cancer Coalition helps a lot of my patients. And I think it's just thinking a little bit differently about support. I've seen some really neat things, somebody that's going through it alone and their neighbor says, I'm going to step into the gap for you, and I'll watch your kids while you go do this. And, I've just seen other patients have different support from the community. And I think if you lean into that, you can find there's a lot of good in your community around you. But the local resources are strong. I think at any cancer center, you can find support within the cancer center itself, especially if people are honest. I always tell patients up front, I'm going to ask you these questions today, and maybe today you don't have a need, but guess what? Things change, and I'm a terrible mind reader. Please don't hesitate to tell someone, because there's so many people that want to help. And if we don't know there's something to help with, then we can't. So I do try to constantly drive that home to people, because you just never know. You don't know what happens inside people's four walls. What they might be struggling with, and everything from addiction to abuse to I'm going to lose my job, and there's just so many facets to cancer.
Yes.
So I think there's a lot of resources. You just have to tap into.
Definitely. And I'm glad you touched on far as local resources, because one thing that I do love about the upstate area, far as like Greenville County, Lawrence County, as well as Spartanburg County, have those local cancer associations to help, whether it's with mileage reimbursement, as well as just like insure, far as for nutrition. So I think it is important to not only seek that help, but like you said, reassuring patients that it's okay to speak up and say, I'm struggling with this, or, I could use help with this. Or like you said, whether it's reaching out to your church community, meals and such. So I think that's a vital point for us, just knowing of those resources whenever things may come about or change. So Caitlin, this is for you. It says, how did you manage side effects with your day-to-day responsibilities, whether that pertain to cooking, whether that pertains to teaching? What things did you see come about specifically in reference to your treatment?
Thankfully, I feel like I have limited side effects. I like touched on the ones that you can hear about. I have nausea, but I never got like sick from it. Things like that. I have like a little bit of neuropathy, but nothing that lasted. So I was grateful for that. So, really just living with my parents. My parents took care of me the whole time. And made sure that any of those was not, like even taking my dog out. So I just was so tired and exhausted, I could not walk my dog. So thankfully, I had them to take care of her. And other things like that at work. I knew I physically, before I was diagnosed, I could not physically. I was like, there's no way I'm gonna continue teaching for that many years. Like I thought I was gonna be a lifelong teacher and I cannot do it. There's no way. And then after I realized like, oh, this is fatigue. This is not tired. And so I was able to kind of cope with that and say, okay, I need to sit down for this period of time, or I am not going to, play with them at recess. I'm gonna sit and watch them, things like that. So I had to like kind of take a back seat. And then slowly work my way back to how things like life was before.
And I know, of course, of being a teacher, what age group of the children that you were teaching? Because as you can imagine, did you feel like that played a part as far as within the classroom, or even like you said, the neuropathy, as far as typing or doing other activities with your students?
Yeah, I had, even at the beginning, so, I had summer breaks off because I was diagnosed last year. So, I think my last chemo was in July, and then I went back to work the next week. And had some time for, teachers to go back early, and then I started with my class, and when I got done with chemo, I couldn't even get up and down off the floor just from like leg pain, or my feet would hurt. We get foot cramps all the time, and I could not walk around and like get up and down off of the carpet in kindergarten, and I would get so mad about it and upset. And then slowly it just went away. Like now I remember I would just kind of sit down and I would get up and I would not need help. I wouldn't need to like prop on something to get up. And I would say like, I feel like an old lady and I'm only 26 years old. I cannot get off the floor. Yeah, it was just crazy to me. I'm like, what is going on? And I have to remind myself, like, you just, survived cancer. So it's okay that you can't get off the floor. So that was hard, but it did slowly come back, and it's not something that has to affect you, I feel like, your whole life.
And, I'm glad you touched on far as like the part of giving yourself grace, because I think sometimes we can be so hard on ourselves. And of course, there's nothing wrong with having high expectations or striving to do the best that you can, but it also can be a lot when you're coming off treatment, as I can imagine, and then also trying to get back in the swing of things. But I'm glad you touched on far as still being able to continue with teaching, because sometimes you have survivors who may ask, will I still be able to work? Will I not be able to work? What should I do about working? And so I think just hearing all of your experiences is really tailored to the individual, as you probably would say, just because everyone's walk of life or employer may be different. So as a social worker, I am a huge supporter of self-care. And so I want you all to answer this question. Of course, we can kind of go from Sarah and to Kaylin. But this question is specific to self-care. It says, did you employ any self-care routines during your cancer journey? And if so, at what point? Also, what effect did this have on your mental health, whether it was stress, anxiety, feeling depressed? What things help you navigate those emotions that came about as you were walking through a diagnosis?
Mine was, I chose to do cold capping.
Okay.
So for people who do not know what that is, it is a system in which when you have certain types of cancer and you have chemo, you can use cold packs to essentially keep your hair and restrict the chemo from going into your hair follicles. So it's very committed. So my mom had to go with me and do the cold capping before and after chemo and during, of course. But I chose to do that because I already felt sick. I did not want to look sick, and I wanted to feel better about myself. And when I was working and stuff, it helped me to not constantly, what's wrong, so it helped me to feel like myself. and keep a part of myself. So I would say that that was the biggest thing that I was able to do for myself. They also have subsidies that help people to, if you can't, afford to pay for it, they have, it's called Here to Stay. Okay. And they help people pay for some of it, like they don't do all of it, but they help cover some of the costs.
Now, I hear a lot of survivors, and of course, even some newly diagnosed patients may say, well, was it a painful experience, or what was it like? So can you touch on that? Was it, of course, brutal, would you say, or did you feel like it was manageable, or would you change anything as far as you agreed to do cold capping? Would you still do it, or would you know?
I would say definitely. It was a very long process because you had to cold cap before chemo, I think like an hour before, you had to do it during, and then like an hour after. So it was just a very long day. There's a lot of new technology that they're coming out with. I think even here, like an automated machine. I had to get like the manual ice packs that you wear on your head, and you had to keep them cold with dry ice. But I would say that it feels initially kind of like a brain freeze.
Okay.
But like after you're doing it for a while, it's really not that bad. Now it was very cold,
Yeah.
and made sure I brought plenty of blankets and stuff, but I think it was definitely worth it.
Were you occupying your time during treatment doing something to kind of get your mind off of the cold capping and not to get fixated while you're having to live?
Actually, the cold capping distracted me from the chemo. Like I was very scared, what's chemo gonna do? Like, what is it gonna do to me? How's it gonna make me feel? And doing that and having to put timers on and change them out I think it was like every 15 minutes or something like that. So, and checking temperatures, it was very distracting. And, and actually it was good bonding time with my mom too, so it was a good experience, and I would definitely.
What about you, Sarah?
So I guess it would fall under self-care. So, I did lose my hair, and, so when I was starting to come out and I knew that I needed to do something, because I have a lot of hair, I said, okay, let's make this fun if we can. So I let the kids shave my head. At first they were very apprehensive. I said, this is the one time in your life you're gonna get so you better get. So they shaved it into a mohawk and spray painted it silver, and like we tried to make it as fun as possible. I think it was pretty emotional for my husband. But at the end of the day, we enjoyed it together. It was kind of a strange bonding thing. And then, I'm thinking about the other things that I didn't think about as a nurse, as I went through chemo. So, there's a day after chemo, everybody's is different. Mine was day 4 after chemo, that I was like, I'm not sure how far I'm gonna go today. So I found if I stayed home, I would get dehydrated and I would sleep, and that's not necessarily a good thing. So for self-care, I found a little quiet coffee shop. It was a local place, not the national chains. But I would go there, I would take a book, and I would sit at the window, and I would have a big cup of coffee, and I don't know that I really read a whole lot, but it kept me upright, and I felt like engaged a little bit without expending all my energy. But it was something I had to do for me, because if not, I ended up kind of struggling. Yes. So that I don't know if the coffee shop ever picked up that I was there every Wednesday, but I was there every Wednesday at the window. Yes. So, that was just something that helped me.
And I think it's important, especially while navigating, a diagnosis that just can come with so many different changes, socializing. Or getting out. And of course, I know energy level and things can, of course, impact, your interest of wanting to do that. But just like you said, because it can be hard, it can get very much hard to not only, have the energy or the desire to want to even go about and socialize just from, a healthcare professional perspective, but I also think it's important to just kind of normalize as much as you are able to, so you can, of course, continue to press through and move forward the best that you can. About you.
Yeah, I guess talking about what you just said, like still socializing, I still went to the beach, like in the middle, and they're like, stay out of the sun when you get chemo. And I was like, I won't get sunburned, I never get sunburned. Well, I did. And you will. So I got very sunburned, but I went to the beach and I did use sunscreen. And I took my dog, and I still, like, I would always make myself, like, on those days where I was like, I'm so exhausted, my legs aren't gonna move, I would still get up and go for a walk. I did a lot of walking, a lot of thinking. I don't like to be by myself, so I was always with someone, which was helpful, but I would just kind of talk about everything, walk, and I would go, still go see my best friend, and things like that. And I don't have a big giant friend group, but I would still go see those people that I knew would help me during that time, make me feel just better emotionally, or just very normal. And they did, thankfully my friends treated me very normal, not like there was something wrong with me or I was sick. So I was thankful for that. Sometimes I was like, I am sick, I'm not going on a 6-hour hike, but I will cheer you on as you go. But that was helpful to still keep doing the same normal things or doing things that I wanted to do, even if I needed help. Like to go to the beach, I couldn't drive myself to the beach, it was too far, but my parents brought me, and I stayed separately from where they dropped me off at my friend's house, and we went to the beach and everything. It just felt very normal, and I was thankful for that.
And it's good that you had a support system, especially including friends, because, from the outside looking in and seeing and hearing of others and their experiences, you can also see the side of patients and survivors may feel like, they can't relate to what I'm currently going through, or they're not understanding or not able to, meet me where I'm at in this current moment. So to have that support system where it's like, it's okay, if you don't want to do that today, that's fine. Or of course, when you're feeling up to it, having that, friend or loved one to say, hey, I feel like getting out today, come with me. So it's good to know that you all had not only the support available, but something that you feel like kept you in a good headspace to keep moving forward and to be positive.
And just like talking about the park, I was gonna say that, not you said that I felt like that a lot as a young person, that I could not find another person that had either the same cancer that I had or could relate in any way. And it was very frustrating for me, a lot of it. And so I did find like a group on Facebook that was for people with the type of cancer with Hodgkin's. And then it was also mostly young people, because a lot of young people get Hodgkin's lymphoma, but it was cool to see different people just discussing it. Even though I couldn't interact with them in person, I could still have that. And there are so many groups out there that even that was helpful for me to see, like, oh, there are thousands of people doing the same thing you're doing. Like, you are actually not by yourself. You have other people doing the same thing. And even going to the park, like I went to the park a couple times just to see, like, well, what do you do at Survivor's Park? And I would go and I was like, oh, okay. And there's like cute little things you can read. And I was like, oh, this is so sappy, but it really wasn't. It was kind of exciting to see different people, and that it's a connection that I think that people don't understand unless you've actually gone through it. I think that caretakers understand in their own, like, caretaking. I took care of someone during cancer, and survivors do as well.
And if you haven't been to the park, please go. A beautiful healing garden, as well as in a space that you can join if you've been impacted by cancer or have a loved one or a friend. I'm glad that you were able to get that experience. So ladies, this is our final topic, and we're going into survivorship. So of course, as you're transitioning out of treatment and now trying to get back into the swing of things, I know that itself is an adjustment, or may even be a little bit overwhelming. But Andrea, this question is for you. What are you being told about exercise, diet, and such after you were done completing treatment? What things were important, or that you felt like your oncologist maybe pointed out that was key for us transitioning to survivorship? And of course, survivorship can be at any walk, even, different stages, but as you transitioned off treatment, what did that look like?
Well, I think there's a lot of mental game that goes on there, but it also depends on different types of medications that you have to take going forward. Me specifically, I have to take a medication called Arimidex, and I'm sure from having chemo and having mastectomy, and I've had hysterectomy, all those fun things. But it impacted my energy levels. It impacted my back hurt a lot, my bones hurt a lot. And I found that when I didn't feel like moving, if I would move, if I would push myself, if I would get that daily exercise, it would help me so much in feeling better and with side effects from medications, and mentally really, really helped me too. And then, as far as diet goes, I try to eat better. Of course, I don't make great decisions all the time, but eating better for the most part and making those changes also is a big effect on your body mentally and physically. But I would say just making sure you move, making sure that you interact with people, getting out.
When did you feel like you were at a point where it's like side effects begin to slowly decrease and not feel as if, like you said, bone pain, back pain? Did it ever resolve, or do you still have those symptoms, or did you feel like over time it got better?
I feel like around the 6-month mark, things started to get a lot better. And I feel like sometimes I do still have, the back pain, but I think just trying to push through, even though you don't have the energy and don't feel like it, making yourself do it makes you feel so much better. But I think around 6 months, things started to gradually improve.
All right, and Sarah, this question is for you. As far as providers, as well as having follow-up appointments, what things do you remember was said or recommended throughout your transition coming off treatment, as well as walking into, part of survivorship for you personally?
So I think one thing that kind of surprised me, even though I've been in the cancer world for so long, was the deconditioning that came with chemotherapy. So I did work with oncology rehab, and that was hugely helpful for me because I thought it was just me. And when I went over there and she's like, "Oh, your heart rate went up." I'm like, "I know." But you kind of are hard on yourself. So that was helpful because, a common thing you tell people is, well, you kind of sometimes have to chase energy, which sounds kind of crazy. But the more I pushed through that, the stronger I got, and it takes time. And I think it would be remiss to say you don't have any side effects anymore, because cancer changes you physically at some point. But I think it's a mental change of attitude of, I'm living with this and it doesn't define me. So I think that's part of it. And then, as you move through, it's obviously important for screenings to take place. See your doctor and follow up. If it's not your oncologist, because as you get further out, you may not have to be followed by your oncologist. So have a good primary care, but stay connected to your medical community, because you're going to need them just for your survivorship journey. So I think it's making sure the screening guidelines, those kind of things, whether that be for, dermatology, mammograms, bone density, routine scans for follow-up. Just make sure you stay on task with those, because sometimes you get a little bit lazy is not the right word, but you get a little complacent as you move further out. And I think it's real easy to let things slide, but you just can't.
Sarah, when the appointments begin to gradually slow down or less of following up, was that overwhelming for you? Or did you feel like it was more of a relief? Because I know sometimes, of course, when you're in the, I guess, flow of seeing your doctor weekly or bi-weekly, and then that gradually changes, was that a lot for you to take in?
I think sometimes you feel a little bit like you're losing your safety net. And I've had other situations in my life where maybe I had, like with one of my children that's disabled, I had services and there are times in life you feel like, well, that's gonna be my safety net if I miss something. And coming to the doctor can kind of feel like that too. But you have to just learn to trust the process, and it's okay to start separating. And some people really have a hard time with that. I'm kind of here all the time anyway. But I do have, I mean, I've had plenty of patients it's a kind of a mental battle of, I'm not gonna see you as much, or I'm gonna move the time frames out. But that's a good thing. And it's just changing the perspective on that.
And then Kaylin, this question is for you. It says, what have you been told about routine cancer screenings?
I feel like I've been told a lot of different things. I did feel very anxious when I did have to leave that more of a routine. I saw my doctor every, hour often, and this is what I did, and it was, in the same building, same time, same place with the same people. And then you kind of start coming, like I felt better, so I would come by myself, and I didn't need people to go with me, and I could do it by myself, and that kind of thing, and I would get like super anxious even just coming towards the cancer center, and I was not coming for chemo, but I was like, I am not going near infusion, I am not doing it. That was really hard for me. And then I was like, okay, once I'm done, and I'm not going back. Not like I wouldn't actually come back to your appointments, but like I didn't need to be here. I felt like I was like, oh, I'm all clear, like I don't need to come. And then when I was told, oh, you really don't need to come, then I was like, well, why not? Like, are you sure? So I did question a lot, and I, even when I was diagnosed, I got a second opinion. I got a third opinion. I still came here, and then I kept questioning it. I think I still do. I think you still have to advocate for yourself throughout your journey during treatment, after treatment, and when you really are like a long survivor of it. I think you have to keep continuing to advocate for yourself and just listening to yourself. That's what helped me to be diagnosed, and I think after as well, to get back to normalcy.
And I'm glad you put emphasis on far as advocating for yourself, especially with being a young adult. And please, I'm curious to know your perspective with being a young adult and having a cancer diagnosis. Did you feel like, of course, workup far as coming to find out that you had a diagnosis, was there any delay, or did you feel like everything was done expeditiously, or was it like, you probably won't have cancer, you're young? How was your experience?
It definitely took a long time. I think about a year before I was turning 25, and I was like, oh, I'm having my quarter life crisis, and I was like upset that I felt so tired. And then a year later, I was like, okay, I'm still worried about, a lump that I had, and I still don't really trust what they're telling me. I feel fine. I still was active. I still felt like okay, but I was very fatigued. So I did have to advocate for myself a lot. I did have to, go to the doctor and make like, this is an emergency phone call, when it wasn't necessarily an emergency, but I had to, go in and very much push my way in. And even switching, the only reason I ended up here is I did have to switch where I was going. I had to see an ENT, for example, and go to a breast center. I went to a breast center at a different place, and then I went to an ENT at a different system, different hospital system. So I did have to keep pushing in order to get those appointments pushed up. And it did take months, but that part was hard to get someone to find this, because people do say like, oh, you're young, like young people are lumpy, or young people don't have cancer, or it's not this cancer, this lump isn't cancer, so you're fine. So you do have to listen to yourself, and definitely if you feel like you need to advocate for something or ask for more questions, like your team makes you feel like I could ask questions. I think that's important to feel that way.
And I'm glad that you were able to advocate for yourself and get what you need, of course, to have a safe treatment plan and to be in survivorship. So I think that's extremely important. So as we bring this discussion to a close, there's one question that I want to leave you all with today, and hopefully this can be encouraging to someone as well as insightful. But if it was one thing that you would want to share with someone who is newly diagnosed, what would that be?
I would say do not Google anything about your condition because I sent myself into some serious panics. And as my oncologist told me, everyone is so different. Every situation is different. Every case is different. So the things that I was Googling and finding results about were not even applicable to me. So let your health team do your diagnosis. Don't throw yourself into panics for no reason. Let your team do their job. Don't try to do it for them.
I think that's so important because we have all of these technology advances, AI, WebMD and such. So as you stated, everyone is different. But of course, I think those waiting periods or not knowing or that uncertainty can have your mind running or just thinking the worst. So I think that's a definitely good point as far as not going to Google. Without you, Sarah.
I think, something I tell people often and even had to do myself is when you're diagnosed, sometimes you have to almost put blinders on or close your ears to all, I call it noise. Everybody means well, they all want to tell you their best advice. And at the end of the day, you kind of have to choose the path and take the path and just shut off all the noise of all the advice and people mean well. Don't get me wrong, but, you just have to trust and do what's best for you. It doesn't mean it's the best thing for everybody else. And just have a decision, for yourself that you know is right for you and kind of shut off all the outside things.
I would agree. Because as you said, what may work for you may not work for the person next to you. So that is a very good. Thank you for sharing that. Kaylin, what would you say?
Mine's similar, but I would say that I think a lot of people feel very helpless or confused, or they're like, oh, it's the luck of the draw, like how's this gonna turn out? And I think that's where a lot of fear and anxiety comes from when you are diagnosed. But I do think that if you can support your own mental health and your emotional health, and you have people supporting you, that you can feel that you're in control of survivorship of your journey, and you can make yourself feel like you have the control, at least for your own mind. And you won't be able to control your body, how it looks or how it feels, and you won't be able to control what other people say to you, or the type of cancer that you got. But you will, after you survive, feel like you're part of a community that is very large, but it feels very small when you are diagnosed.
Listen, I want to thank all of you for joining us today. I know it can sometimes be a range of emotions when you share personal experiences, especially one connecting to cancer. So I just want to thank you all personally. And thank you to our audience for joining us today for the Cancer Prevention and Wellness Series. And we hope that you visit our lovely park, the Cancer Survivors Park Alliance. And thank you for tuning in. And we're going to officially end the Zoom.